to the point where rats had started nibbling at her toes. And when we got to her, a neighbor had checked on her finally and said, hadn't seen her for a while, and did a welfare check and found her. And she had, maggots were starting to eat on the toes to leak any information, because that's a big penalty if you leak patient information to the wrong people. But we've got to be able to get into the hospital system and look up information on our patient, and they should be able to look into our system and look up information on the patient, so they're not.
All right, it's another episode of the Let's Get Comfy podcast. We are back. Florida's #1 healthcare edutainment station, home for love, peace, and joy, but most of all, comfort. I'm your host, Norman Harris, and sole proprietor of Let's Get Comfy podcast. We have a special guest dedicated to Pasco County, Tampa, Florida, Tampa Bay area, actually. A historian, a legend, Dr. Thomas Edwards. Welcome to the show, sir.
Well, thank you. Thank you for having me.
Yes, sir. Dr. Edwards, I thank you for joining me on the show, man. It means so much to me for having you. But just tell the audience, let you do your own introductions, because it's a long list.
Oh my goodness, I don't know if you want to hear all of it.
Yeah, tell the audience who Dr. Edwards is.
Well, I'm a jack of all trades, I guess, to sum it up, in the medical field. Started off in high school, wanted to be a paramedic, and had to wait till I turned 18 to take the first EMT test. Worked my way up in paramedics from Alachua County EMS. I was one of the first rescue chiefs for Alachua County EMS in Gainesville. Did that for 6 years. Came back to my hometown of Dade City. Became firefighter paramedic, and after I went to medical school, of course. And so I did firefighter paramedic for about 14 years. And then I've been a physician for 33 years. So in EMS or medical field, it's been almost 50 years, 49 years in the EMS medical field. I'm still medical director in an EMS for Medfleet Ambulance. I've been there since they started.
Yeah, Medfleet.
And I've been medical director for several skilled nursing facilities. Pasco Rehab, that is now been closed in Dade City years ago. Royal Oak Nursing Home, Dade City Health Rehab, which you hired me there.
Yes, sir.
When you were the administrator there.
How many name changes you've been through there at?
Oh my goodness, with all of them. All of them. Yeah, probably about 5 or 6. I remember when it used to be owned by the city. The city of Dade City used to own Dade City Health Rehab.
Wow.
So it was called, what was it called then? I think it was Dade City Health Rehab. They got full circle back to it.
Full circle back to it.
Yeah. But, and I've used to have an office, and always did long-term care in nursing homes. Did a little home health where I went out and saw patients in their homes. Did that for a while. ALFs as well. And but been nursing home doc for the whole time, and do that full time pretty much now, as well as hospice. I'm also medical director for St. Leo University for their student health clinic.
Right.
And I work as a team physician for Gulfside Hospice for the east side of the county.
Mm-hmm.
And I'm also a kind of a not really medical director, but a area physician for 2 companies, Longevity, which is a insurance company that takes care of long-term care patients with nurse practitioners, and then also Optum, which does the same thing. They are an offshoot of United that takes care of United Health patients in long-term care facilities. So a lot of extensive work in long-term care facilities as well.
So audience out there, comfortably listeners, as you can see, that was a long introductions.
Sorry about that.
He's a very accomplished individual for sure, and this is why I had him on the show, so he can share his insight and expertise with you all today. So I'm so happy you join us. Dr. Edwards was one of the first batch of paramedics
Yeah.
in the state of Florida.
Yeah.
One of the first batch. So 49 years of emergency management services. So at the heart of what he does, it comes from a good place, and it comes from his foundation, almost 50 years of this. So wonderful, glad to have you part of the show, and you've worked in almost every level, right? Yeah, every level of healthcare, from hospice to home health, home care to skilled nursing,
emergency
hospital.
to end of life.
Yes, sir, from emergency to end of life. So we get the full scale perspective, but we're going to rewind this thing a little bit, Dr. Edwards, and take me back to young Thomas Edwards. Just tell me about just where you're from originally, your parents. Yes, sir.
Born and raised in Dade City. My mother and father, my mother's still alive. She's 93. I take care of her. She still is independent in her home.
Really?
Yep. And we take care of her at her home. And Judy Edwards, and then my father, L.G. Edwards. He deceased actually when he was age 65, and I'm 66 now, so I've won out on that aspect. But he died of esophageal cancer, and took care of him at home as well.
Sorry for your loss.
And then also took care of my my mother-in-law. We took care of her before at end of life within our home. So I'm very familiar with being a caregiver.
Yes.
But went to Pasco High School and was shy. They called me Timid Tom.
Timid Tom.
Timid Tom. I don't tell many people that, but
Timid Tom.
Timid Tom. So I was very shy, and actually
they used to call me Normal Norman.
Oh, really?
So yeah. So Timid Tom. Whatever the kids can just make some fun of you, huh?
Yeah. Kind of what broke me out of my shell when I became a paramedic. You have to kind of learn to take control of the scene, or take control of the situation, or be able to interview patients and so forth. Being timid, I was very shy and not very outspoken, and you could tell. So one of my partners called me aside and said they noticed I had that problem, and said, "Why don't you do this? Become an actor." I said, "What do you mean, become an actor?" He said, "What's your favorite paramedic that you look up to?" And at that time, there was a show on TV called Emergency. It was the only show for paramedics and firefighters that was on TV at that time. The first one out of California is Johnny Gage and Roy DeSoto were the two paramedics there. And Johnny Gage was my hero. I wanted to be like Johnny Gage. So he said, "Well, here's what you do. When you walk out of your house in the morning, you leave Tom Edwards behind, and you become Johnny Gage. You act like Johnny Gage, you look like Johnny Gage, you do everything Johnny Gage does." Because he was kind of an easygoing guy, but yet he could get things done in a nice way without insulting people or being mean. And it worked. After a year or so, it just became natural, and I was Tom Edwards, in my mind, just as good as Johnny Gage.
Johnny Gage or Cage?
Gage.
Johnny Gage.
Johnny Gage.
Okay, so
good program.
So a lot of people now, if you're out there, you want to check his Instagram, it's probably under Johnny Gage. All right, Johnny Gage. People change their Instagram names and stuff like that.
That's a good idea.
Johnny Gage. I'm start joking with you about that too. Thought there was when I call him and say Johnny.
Yeah, I don't know. He's probably still alive.
Probably so. Yeah. Well, that's good though, and that was great advice from that individual too.
Yeah.
What's his name? You remember his name?
Mitch. What was Mitch's name? He's dead and gone now.
Yeah,
but,
okay.
I can't remember Mitch's last name, but
to Mitch's family out there, rest in peace, Mitch. That was wonderful advice. Really was. So current life now, family life, and how does family impact your business, your organization?
It does impact my organization. It's one thing I feel really bad about as a physician, as there's probably a lot of physicians, is that we kind of put our family life aside somewhat. And unfortunately, because we're always on call.
Always.
And you never, you have to sometimes say, I'm sorry, I can't I got to take this call, or I got to go see this patient or something like that. So that's one thing I feel bad about, that my kids have grown up not knowing their father as much as they should. So,
That's
but I try to still spend as much time and guidance as I can with them.
That's good. But from that aspect, you was doing it with the right heart, right? You want to be a provider,
right?
And do what was best for your family. Right. But just sometimes the career field or the area that we choose requires that sort of that commitment. So,
and I tell my daughter, who's she's pre-med now, she wants to go to medical school. I said, choose. If I had to do it over again, I'd probably be an anesthesiologist, because they make good money, and when they're off, they're off. They don't have to take calls or anything.
That was actually crazy that you say that. When I was in high school, I was looking at a career path. Like I joined the Florida State Upward Bound program, and I didn't know, it was like 10th or 11th grade, and I still didn't know what I wanted to do, as far as when I got out of school. And my mom used to have these encyclopedias. I don't know how she got every letter of the alphabet, but she had every letter of the alphabet, encyclopedias. And I looked in there at the time it was called nurse anesthetist, right? Yep, and I looked it up, nurse anesthetist. And my cousin actually went to school, Jarrell, to become a nurse. But when I did a little research, I was like, they have to see blood and stuff like that, and I got scared.
Yeah.
So I didn't do it. But yep, but it's crazy you say. I don't know, that just came to my mind at the time. But so sports. So Dr. Edwards, unfortunately, is a University of Florida Gator fan.
You say unfortunately.
He's a Florida Gator. I'm a Seminole and a Rattler.
Oh my goodness.
Yeah, so
Seminole part anyway.
Seminole and Rattler. But just tell us, you played sports in high school, right?
Right.
What sports did you play?
My biggest sport was tennis. I was number one on the tennis team all 3 years in high school.
Wow.
And we actually went to state, won our conference and everything. So, and I was ranked as very low in the rankings for, at that time it was called the United States Lawn Tennis Association.
Wow.
Although we didn't play on grass, we played on all surfaces. But when I was younger, I used to go to tournaments in Lakeland and Tampa and so forth. And
really?
And
how many people used to be in the crowd?
What do you mean in the crowd? Oh, in the crowd?
Yeah.
I try not to pay attention to that. I never played in stadiums. They were just kind of out and about. So I wasn't that high in the rankings. So I never won anything.
I was joking with you. Hey, but you also played football and basketball.
Played football and basketball. Tight end was my favorite.
Tight end.
They tried to make me a quarterback, but I didn't like being a quarterback. I like what I really like to do is defensive ends. I like to tackle.
You like to tackle people, all right? But so
basketball,
right. I want to ask you, what's your favorite University of Florida quarterback of all time?
Oh, Steve Spurrier.
Steve Spurrier. Okay, why Steve Spurrier?
I met Steve Spurrier my dad was a Bull Gator.
Okay.
And so he loved the Gators, and we went to all the football games. And he introduced me to Steve Spurrier back when he was actually a player.
Oh wow!
And then later again when he was a coach. So I've always liked Steve Spurrier. I got an autographed picture of him.
Okay.
Yeah.
I can't be a hater about that one.
Yeah.
I can't hate you. All right. So and top running back of all time for the Florida Gators and wide receiver.
Oh, running back! I didn't know you were going to hit me with that. What was his name?
Emmett,
yeah.
Emmett Smith.
Emmett Smith, yep. Mm-hmm. Yeah. And as far as in wide receivers,
I had a number of them.
A lot of good ones. I can't think of one.
Yeah, Taylor Jacobs. Yeah. You've had what was Riedel Anthony played for you all?
Yeah.
Andre Caldwell. I like him.
Yeah. There's just a lot of good
ones. They all
caught on, so it's hard to pick one.
Defense. Last one. This is a defense player.
Oh, defensive player. Mm-hmm. Again, we had a lot of good ones. I can't pick one out individually.
Not one individual?
Not really.
Gotcha. Let me try to think of mine.
Now for the Bucks,
The Bucks, you could. Okay, I'm a Bucks fan there, so we are together there.
Yeah, yeah.
But defense, probably for the Florida, I would say, and I'm not a fan, by the way.
He says that
Probably was
sternly.
Keywan Ratliff.
Oh yeah,
Keywan Ratliff was a pretty good player. I
yeah.
like him, and probably Keywan Ratliff. Brandon Spikes too.
Oh yeah.
I like Brandon
Spike's good.
Spikes was a good
Yeah.
linebacker, but probably Keywan Ratliff though.
Yeah.
He would get my number one.
Yeah.
But all right.
Okay.
Yeah, thank you for sharing that, Dr. Edwards. But let's go back into it, and we're going to talk about your passion. And what do you do currently? Your current employment status. What do you do right now?
Right now, I am long-term care, which means nursing home doc. I've been doing that the whole 33 years. And that's a passion of mine, as well as end-of-life care is a passion of mine with hospice.
Okay.
That's kind of one of my newest passions. And then EMS has always been a passion in life. And as I said, I'm medical director
Medfleet. Yep.
Medfleet ambulance.
But that's the thing I admire about you is the same thing is sort of how you started. You still you didn't just lose track of it or stop doing it.
Right.
You continued on at least having an impact in those areas still. And I use Medfleet. Probably everyone here in Pasco definitely is know about Medfleet. So that's a plug for you, Medfleet. But what influenced your treatment style, your treatment method?
And it started as out in EMS too. Probably from the way my father brought me up. He was in business and insurance and real estate, so he was big in treating people right. And he was what he would say, if he didn't like somebody, which he always liked everybody, he said he'd kill him with kindness, basically. Not actually kill him, but he'd be extra nice to that person. But basically, it's not that I was trained in marketing. It just kind of came naturally from what my father taught me. And treat people like you'd want to be treated.
Starts at home.
That's the nice thing. Yeah.
Starts at home. So if a patient out in the audience right now, what can experience they can expect when they come and visit Dr. Edwards?
Well, I'm going to sit down with you and I'm going to talk with you. I'm going to find out what I can do. One of my favorite questions is, what do I need to know about you so I can give you the best care possible? And that really opens up a lot on a personal level. It makes them feel like you care about them and what you want to know about them as a person, not just treat them as another patient or another number. And I try to respect them as a person. I try to, a lot of physicians try to push their will on the patient. Well, if you don't do exactly what I say because I'm the doctor, then I'm not going to treat you anymore. You can go to another doctor. So I get a lot of patients that way. A lot of doctors give their patients up because they're not doing what they want them to do. And I'm flexible. If the patient wants to be comfortable, wants to not go through certain things, that is their right.
That's their right. You're right.
That's what I let them do, and I try to help them be as comfortable as possible in that and not give up on them.
Right. You're there to lead and sort of guide, but you also let them have the sort of the control of over their health care and their bodies as well, because technically they know themselves or should know what they feel. Right. So having that open line of communication.
As long as they're informed, and I inform them, and I say, but it's your decision.
Your decision.
I try to make it a cooperative thing.
Gotcha. So can you sort of explain your private practice and your organizational structure?
Well, it's a very easy one. I used to have a hospital-owned practice with a couple different hospitals in the area, and as a family physician and seeing patients in the office, and still did the hospital and the nursing home on the side. So when my twins were born, 21 years ago, boy-girl twins, my wife said, I need help. And so I gave up the office and just did nursing home full time, which provided a lot more flexibility in my schedule. But
Listen, that's good.
So if and sorry, I forgot your question.
So the question was, what's in your private practice? What's your
Oh yeah.
organizational
So my
structure?
organization is
Yeah.
basically my wife is my office manager, so to speak, my biller and everything like that. We do everything to keep the overhead low, because when I was in a hospital practice, they really inflated the overhead. I mean, a typical physician's office has it at that time had at least 50% overhead. Um, and with a hospital practice, it's even more than that, because in the hospital takes more of their cut out of it for their administrators and so forth. So I kind of got tired of that, and as well as my twins were born. So we developed a model where it's a mom and pop model. My wife takes care of all the billing and the credentialing and stuff like that. I basically do just Medicare and Medicaid. I don't do any HMOs or PPOs, very few anyway. So the billing's pretty straightforward, and she takes care of that beautifully. And I see the patients. I work out of my home, and just travel to the different nursing homes or hospice facilities that I need to go to.
Well, shout out to Mrs. Edwards.
Yes, ma'am. Yes, sir.
Mrs. Edwards. All right, a team effort, but also just having that open line of communication in your marriage, one, and for you to make the adjustment when the time was right. For when she said she needed help, you did something about it, and that's important. Probably actually why y'all probably still together now too. Yeah. So man, I congratulate you for that, because it takes a lot to still be in tune at home when you have such a high demanding job. So I commend you for that. Yeah, seriously, man. So if your career was a movie, right? What would the title be of your career right now?
Oh my gosh, what would it be? You come up with the craziest questions. But you're fun.
Yeah.
I have no idea.
You got to give me one. Come on, Dr. Edwards.
A title of a movie.
A title of your movie, your story, your chapter.
Well,
right
just
now.
say Dr. E.
Dr. E.
Smiley E. I got a patient called Smiley G, and he calls me Smiley E.
Smiley, okay.
Because I'm always smiling.
That is true. I've yet to see, just with going back from our history as well, and I want to share this. Why you say Smiley E? So I'm going to share our story, Dr. Edwards' story. So I became a nursing home administrator it was at the time, of course, those 5 name changes so far that you experienced was Orchid Cove at Dade City. Orchid Cove at Dade City. And I became an administrator there, and at the time we had a different medical director, but my director of admissions and business development, Joni, she said, "You need to get Dr. Edwards in here." I said, "Dr. Edwards, who's that? I don't even know him like that." And she said, "Well, he good." So I talked to my nurse clinical leader, my director of nursing at the time, and I asked my unit manager, just asking the team. I was like, "So what physician y'all like, here?" Because I'm new to the facility, and they was already on me. We need a new medical director. We need a new medical director. And every time it came up, Dr. Edwards, Dr. Edwards. So I reached out to you. I said, "Man, hey, Dr. Edwards, I'd like for you to become our medical director here. I want to go through the steps to do so." And and that happened.
I appreciate that.
I never regretted it. I stayed in contact with you throughout my career after that. And just you've always been willing to help, whether virtual visits that we have, and you've already been up on technology in the field as well, in the medical field.
Oh yeah.
So yes, sir.
But I started off with my own EHR, kind of put together my own EHR before electronic medical records was in vogue. I saw that coming. So
gotcha.
And I said, I want to do that. I'm tired of writing stuff. Plus, you can't read my writing. But you are a very good administrator. You're a very good administrator.
Thank you. I appreciate it.
One of the best I've been with. So.
I appreciate it, man. And I've heard that, but I always be thinking like, I can't believe they say that. I be thinking that all the time. Yeah. Like, how they say that?
And you probably didn't know at the time, but I'm still one of the only certified medical directors in the area.
Really?
So I'm surprised that more nursing homes haven't hired CMD, certified directors by the American Medical Directors Association in long-term care.
Got it.
And because we're trained in being medical directors for skilled nursing facilities.
Right.
And,
To sound good, I'll say I knew it.
yeah,
I knew that. I knew you was
okay.
already certified and everything. I'm lying.
But a lot of nursing home administrators don't know that, or they don't care about that.
So let me repeat that again. So NHAs, nursing home administrators out there, if you're in the market, right, looking for a new medical director, you should search for
Certified medical director from AMDA,
AMDA.
American Medical Directors Association.
All right.
And they put us through a very rigorous course and to certify us for that.
All right. Thank you for that. So, what's the most surprising thing you've learned about yourself just this year?
Just this year?
Just this year. We'll take it because I know just this year about you.
Surprising that I'm getting old.
Yeah,
I'm starting to feel it.
Yeah.
When I thought I'd feel it when I turned 50, but when I turned 65, I don't know if it was in my head or not, but I'm starting to hurt a little bit here,
Little aches and
bit
pains and
there.
stuff.
But I still try to stay active and run.
You still
and
play
so
tennis?
forth, so. Not as much as I used to. Yeah,
But you still
haven't
try.
played in a while.
That's good. That's good.
Yeah.
Just from an accomplishment standpoint, because you list so many, and which is wonderful. Just what one of the things you say you're probably most proud of, whether it's an accomplishment or a project that you worked on.
Probably most proud, other than my kids.
Right.
I love my kids. I'm most proud of them, and my wife that I have. I'm most proud of her.
Yes.
But probably the most accomplishment is becoming a paramedic and being one of the first to what we call the originals. We still have a group. We get together twice a year. We try to call the originals for that. We started Alachua County Fire Rescue. It was actually called Alachua County EMS when I was hired there. But then they took in the fire department component and changed the name to Alachua County Fire Rescue. So I was the first hired as the first rescue chief for them. I was the youngest rescue chief. Worked as rescue chief for 6 years. And probably my biggest accomplishment is being involved in EMS all these years, and doing the right things for patients, whether it's an EMS situation, long-term care situation, office situation, or end of life. And I like being able to guide people through their end of life care and keep them comfortable as well.
All right. Yeah, that's very important out there, and you've been doing it for a long time. I got to keep saying that. A long time.
It doesn't seem like it, but it seems like just yesterday.
So we're going to do another break.
All right.
Another confident company, education and entertainment. At Comfort Measures Consulting, we're here to help you navigate the complexity of healthcare. If you're caring for a loved one as a caregiver, you don't have resources, you don't know what questions to ask, you need to have options, right? Give Comfort Measures a call. Give us a chance. First consultation is free. Speak with me, Comfort Measures Consultant, 850-879-2182. You can also visit our website at www.comfortmeasuresconsulting.com. Talk to you soon.
Okay.
So you get 3 seconds to respond. So the first thing you come in your head, okay?
Sometimes that doesn't happen in 3 seconds.
3 seconds, okay.
But we'll try.
We'll try. All right. So, favorite color?
Red. Fire engine red.
Fire engine red. All right. Next one is favorite actor.
A favorite actor. Who is my favorite actor? I guess Johnny Gage. I don't know who the actor is.
You don't know their names. You like me. I be knowing
I
how
don't
they look
know
at my face. But yeah. Favorite show, TV show.
Favorite TV show. Gosh, that used to be Laugh-In when I was a kid.
Laugh-In?
Yeah, I got a lot of favorite ones.
A lot of favorite ones?
Yeah.
Okay. If you had to eat one meal.
Oh, wait, my favorite show now, though, is OP Nation. It's On Patrol Live. That's
On Patrol Live.
Yeah.
All right, got it. If you had to eat one meal every single day,
Oh, that's easy.
What meal would that be?
Steak.
Just steak.
Medium rare. Yeah, that's all. You
I'm
want
saying the
food, the
full
whole of the
dish.
meal? Well,
The
got to
full
have
meal.
onions with it, and
Mhm.
green beans, and garlic bread.
Oh yeah, okay. You eat that every day.
Yeah, I'd eat every day.
All right, okay. And what is your do you cook?
Not as much as I used to.
All right, what would you say your staple dish in your family?
That my wife cooks now is
That-
chicken.
Right, that's your wife chicken?
If it was me, it'd be steak.
It'll be steak, got it. Fried or baked? How you like it?
I like it grilled.
Grilled.
Oh, the chicken?
Yeah, the chicken.
Oh, I eat it anyway, but fried's my favorite.
Fried your favorite. Good old fried chicken.
Yeah.
Do you
It's
like
bad for
Steph's?
me, but like what?
Do you ever go to Steph's in Dade City?
What's it called?
It's called Steph Soul Food, I think. Steph
Oh
Soul
no, is that the one that's behind the church?
Uh-huh.
I haven't ever been there, but I know where it's at. And
Go.
people say it's good.
Go.
Yeah.
Go.
It used to be called something else, Johnny's or something like that.
Oh, really?
I think
Well, when I used to work up there in Dade City, we had, as a family, we started going there like once a week. We was addicted to it. But it's good, man. And if you could take one celebrity on a date, who would it be?
On a date?
On a date.
It'd be my wife. She's my celebrity.
Really? Oh,
She's my celebrity.
Oh, he just saying that.
No, I'm not.
You have nobody though.
No, I
Nobody.
wouldn't date a celebrity because they're
Would they?
too, they don't have a private life.
They don't have a private life.
Yeah.
Now they ever said like he liked privacy. And your favorite place that you ever went on a trip to?
My favorite place is the mountains. I love going to the North Carolina
North Carolina mountains.
Yeah,
I like
hiking.
that. Yeah, I don't know about hiking, but I like just the temperature and everything up there.
Yeah,
Florida is a little too hot and muggy, you know.
Yeah.
All right, but back to the show.
All right.
Back to the show. All right. So health advice, of course, the mission of Comfort Measures Consulting and Let's Get Comfy Podcast is to empower listeners with the knowledge and resources to age comfortably. So next category here is health advice. So in long-term health and wellness, just what are some general advice that you would give individuals above the age of 50?
Keep active as much as you can. Physically active, moving around. When you stop moving, your health goes down quickly. And keep your brain active. Reading, crossword puzzles, music, anything like that stimulates your brain.
That is very interesting.
So,
I was speaking to I think the doctor, and she was telling me about an app that they're actually working on that help patients with help sort of prevent sort of that cognitive loss and decline. So there's apps out there for that. But you're right, that is wonderful advice. Keep your mind active and your body active.
Yep.
Right. Not stationary. That's wonderful
Keep
advice.
moving.
Right. And advice for caregivers out there. You have a long history of being caregivers for loved ones yourself. Just one thing that you'd say that you wish you would have done as a caregiver, and not necessarily associated to the care that you were provided, but just for yourself during that period of time.
Well, I don't think I had a problem with this, but I would say be patient and be understanding.
Right.
It's hard to put yourself in their shoes. And how would you want to be treated when you get that age? You become more like a child again. Some people do become more like a child again.
Right.
So,
any resources you would advise that maybe you utilize? I know you're a physician, but that you found helpful, or if you didn't use it, just any resource that you think that people should take advantage of.
Well, I kind of grew up before computers, and computers are very useful. But you got to watch where you get the advice from, because you got a lot of bad advice. So you can search a lot of things on the internet, as long as it's coming from reputable sites, like Mayo Clinic, or as far as medical advice, Mayo Clinic, or there's several other good sites out there. Just don't get involved in a lot of these blogs that say, you get a lot of people ranting on about they do this and do that. You get a lot of bad advice with that, but you can get some good guidance that way. And
a lot of people are healthcare experts these days.
Yeah.
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 Okay.
But the main point of that is to educate yourself. Educate yourself as much as possible. Even unfortunately, even in the medical world, you can't always rely on physicians to know everything,
That's
and
true.
that's coming from a doctor.
Mm.
We don't know everything, and we're not God. So if you don't like what one physician's saying, research it. Politely say, well, what about this doc? If they're not willing to work with you, find somebody that will.
That's my other one. That's a good one. And your collaborations with hospitals,
Mm-hmm.
you've always done. So, what are some of the, I guess, things that you feel from an improvement standpoint that you think the hospitals to the skilled nursing facility or rehabs transition? What areas you think can improve in that?
The same thing that CMS wants to improve, and all the experts, communications. And even though we've tried to make strides at communications and demanded communications, we still don't get to communications.
Mm.
HIPAA a lot of people don't understand the HIPAA Act. Doesn't It wasn't meant to deter communications. It was, but because of that, they seem to not want to communicate with us. I mean, we'll have people that we'll send to the ER, and they'll send them right back, but they won't send us the information on what they did. And it's like pulling teeth to try
Pulling
to
teeth to
go
get
through
it.
their medical records department to get it, and so forth. So it just shouldn't be that. It should be more streamlined.
So it's almost like being imprisoned by the HIPAA law, the restricted by it, you
Right?
know?
They hide behind HIPAA, or they say it's HIPAA, but really we're caring for the patient, so HIPAA's not involved. But a lot of people in between don't know that
Right,
for
right.
some reason.
And just I'm glad you stated that because a point I actually did a post about this a while back on LinkedIn is how can we improve communication with the hospitals, with the care providers out in the community,
Yeah.
because really it's almost like the hospitals are like this major, almost like monopoly, right? You know,
Mhm.
everyone's going to have to go to the hospital, right? And that from there typically is where all the other care providers actually become involved. But it's so much limited access to hospitals, and I understand why, right? Because if you have every level of care wanting access to you,
Mhm.
it's sort of hard to sort of open up that gate to everyone or give that access. But
Right.
do you have any advice for that? How we can communicate? Because I even posed a thought. I'll just share this with you, and I'd
Mhm.
like to hear your thoughts on it. Of like hospitals having like a particular day, like a vendor day, so to speak,
Hmm.
where they would have a dedicated case manager or care coordination team member to just be there for different time gaps, you know,
Yeah.
whether it's assisted living facilities. Hey, this is your time gap for the day or for this week.
Yeah.
Skilled nursing providers, you know. So that was sort of like an advice I gave, but it's such a restricted space.
Yeah, if we could, when we started off with the mandating medical records and EHR in medicine, the thought was that we would be able to share information. And with all the different EHR companies out there, they haven't really integrated with each other. And
Mm.
if we could somehow, and I understand privacy and the resistance because they don't want to leak any information, because that's a big penalty if you leak patient information to the wrong
Right.
people. But
Hmm.
we've got to be able to get into the hospital system and look up information on our patient. And they should be able to look into our system and look up information on the patient. So they're not relying on calling the nursing home to get information, and they might get a nurse that's never worked with them. But if they look into the patient's chart, they can get more information. Um, so it needs to be right now and not. I mean, it's a good idea that you have for the liaison, but we need information right now in a
Mm.
lot of cases,
You're right.
and we can't wait. And so does the hospital; they need information right now,
Exactly.
and it could head off a lot of things like the DNRs and so forth. But Also, just in physicians' offices, physicians' offices can share with the hospitals and nursing homes and so forth. I think it would cut down a lot of redundancy and a lot of problems that brings up.
Yes, I agree with you. I agree with you. Advancement in technology forthcoming. Do you know about any advancements or anything you're excited about from a technology standpoint?
Well, excited and kind of weary about, or leery about rather.
Leary, okay.
AI. AI is a big thing out there now, and a lot of people are leery about AI. I think AI has its artificial intelligence has its purposes. In a lot of ways, it can shortcut a physician's um, thinking and decision making. But in my experience with AI, just in coming up with lectures or something like that, my kids kind of turned me on to AI a while back when they were in college, because they use AI a lot to come up with their papers and so forth. But I don't know if their professors want them to know that, but so they said, "Hey, Dad, I was gonna do a one on constipation for a group of nurse practitioners." So I said, "I'll try this AI." They hooked me up with a couple AI things. So I put, "Give me all the latest on constipation." It put out beautiful looking lecture on constipation, but then I spent more time fact checking it to make sure I was right, that it was right. I did find some errors, so it's not without errors.
Right.
It depends. It's just like what you put in is what you get out to a
Right.
computer.
Mm-hmm.
So same with AI. Um, but I think it's beneficial in when you first have a patient. Maybe the nurse that checks them in could put all their symptoms into the computer, and AI could shorten your list of differentials, and then the physician can choose. I don't think there's anything that's going to take the place of a human weighing through the information that AI gives them to then kind of shorten the time that they have to spend, hopefully, with figuring it out and narrowing it, or that might bring up something. Oh, I didn't think about this syndrome that might be a cause too.
Yes.
So
there's advantages and disadvantages, but
yeah,
um, still need that sort of personal touch,
yeah.
human touch.
I don't think you should rely solely on AI, but
No,
it's a
no,
benefit.
no. What are some questions you wish, just from a caregiver standpoint? What are some questions if you have a patient coming in to you or a loved one with their mother or father? What are some questions you'd say they should ask, or you like for people to ask more of?
What do you want? Where are you in life right now, and what do you want?
Good.
Are you tired of poking and prodding and the medical system sending you to this specialist, that specialist, that specialist? Some people want that and want to find out about it, but some people have been through all of that, and it's difficult. And they just want to be. I have a lot of patients say, "I just want to be left alone," and you got to respect that and help them through that process. And then they may change their mind at some other point, and you can let them know.
Right. So as what I can just understand, and this is what I knew about you as well. You're all person-centered care.
Yes.
Person-centered care, focus on the patient, what they desire, and a lot of times we see in our industries too, loved ones will get involved and they're sort of speaking for the patient,
Or they have a different agenda.
have a different agenda, as you know.
Yeah.
As you know, but a lot of times the care should be focused on the individual because this is their body and they should have some control there. How do you
And I should add to that it's important to understand when you have caregiver resistance, they aren't on the same page as the patient. I had this the other day, a lady in the hospice unit that was a full code. And yes, you can be in hospice and be full code, which means if your heart stops and you stop breathing, they have to do chest compressions and breathe for you, and may end up in a ventilator and so forth, probably crack some ribs and so forth. So this lady looked like a Holocaust victim. She was on death's door. She could go at any time. And they told me she was full code. Why is she full code? Because the husband hasn't brought himself around to the realization that he's going to lose her. And so in that aspect, instead of being mad like the sister-in-law was mad at him, you have to say, Well, you have to delve into what's going on with him. So he's now a patient as well. Why is it that you feel this way? Instead of being resistant against him, no, you got to do it this way. You got to make her a full coat. Why don't you? What are your fears? And get them to talk about that and get them to come around. Well, but this is the reality and what's going to happen to her if we do this CPR and so forth. So it's kind of a balancing act. A lot of physicians don't go the extra mile.
Yeah, go the extra
do.
mile.
Yeah.
It's almost like your counselor as well.
Yep.
Yes, sir. So just throughout your career, I know you was in EMS a long time, paramedics. What is one of the most memorable stories you have, like that just stuck with you to this day?
Funny or the traumatized?
No, doesn't. Just any story doesn't have to be funny.
Well, probably what some of the things that bother me. I don't know if I mentioned this at the beginning or not, but the way elderly people are neglected. I had one instance that still has nightmares about this today, where I think this lady was in her 90s. She was out in the rural community outside of Gainesville, and she lived in a little trailer. And she had rolled out of bed for some reason, fallen out of bed, and was trapped between her bed and the wall of her trailer. And she laid there for something like 5 days, to the point where rats had started nibbling at her toes. And when we got to her, a neighbor had checked on her finally and said, hadn't seen her for a while, and did a welfare check and found her. And she had, maggots were starting to eat on the toes and so forth. So it was a pitiful scene. I mean, she was almost ready to go. The thing that bothered me about that the most is her son lived next door. Never came and checked on her.
Never came and checked on her.
And I just, to this day, I don't understand that. And there's a lot of elderly people that are that way. There's nobody to watch out for them and check on them and advocate for them.
Wow.
So,
man,
I got a lot of funny stories too.
Right. I know, but that's a touching story, and it I can see how that sticks with you.
Yeah,
I can see
seen a lot of bad accidents and everything, but those are the things that bother me most.
Yeah. And I just share a story for me that stuck with me to this day is during COVID. We had a COVID unit facility, and one of our residents there, he was very afraid of getting COVID, and I just remember, I don't know why him, because I've talked to many patients. I used to sort of go in and be personal to them when they actually was tested positive for COVID, sort of give them the protocols and procedures and why we're doing what we're doing. And I talked to this gentleman. He said, I was in this room, gowned up. You have to go the whole thing. And he said, Norman, I said, hey, man, we have to move you over to our COVID unit. We'll do that today, later on today. He said, Norman, he looked at me. I just still can see the look in his eyes. Like he said, I don't want to die.
Yeah.
Yep. And so we moved him over to the COVID unit, and about a week and a half later, or 9 days later, he died. Mm-hmm. So I was like, man, this, because I could see the fear in his eyes. But so yeah, that stuck with me as well.
Yeah, some people know.
But I've seen multiple, people pass away, all that. But that one there just stuck with me.
Yeah.
Yeah. But
pulls at your heartstrings.
Yeah, for sure. And I know you have a lot of stories, but your just dedication to Pasco County. Why Pasco? I know it's home for you, but just your general impact on Pasco County. If you can just share that with the audience.
Well, yeah, born and raised here, know a lot of people. Wouldn't be any place else other than as I get older. If I retire, maybe I'll go up to North Georgia where it's a little cooler.
Yeah,
but not too cold.
Yeah. And then, so you know about the kumquats?
Oh yeah.
Kumquats.
Yeah, that's right outside of. I live in San Antonio now, and the next little area over is the kumquat capital of the world.
Kumquat capital of the world. I
St.
actually
Joseph.
big shot was Dade City or San Antonio, right?
Uh-huh.
I think it was it. But the Kumquat Festival is big boy talk here now. Kumquat Festival made the Food Network channel.
Oh, did it?
Yeah, it
Oh,
made
okay.
I
Yeah.
saw it on. I said, look at
That's-
Dade City on
That's
there.
in Dade City, but the actual capital where they grew all the kumquats was out in St. Joseph, out St. Joe.
Oh, okay. So this is a real history right here. Real history. So, but yeah, man. So
Yeah.
thank you, Dr. Edwards. Anything else and last thoughts of to the audience here, our comfy listeners, of one, where they can locate you at your offices, if you'll share that with them, but also any website or social media you'd like to share with the audience?
Not really. Like I say, I don't have an office. I work in nursing homes and other facilities. So kind of a SNFist, if you will, skilled
Sniffist.
nursing facility doctor. So
Okay.
So there's really no office or websites or anything I can think of.
No website. Okay. But I'm going to say this for Dr. Edwards. Just Google him. Google Dr. Thomas Edwards, Dade City or Pasco County. He's gonna like so many different websites. What is it called? Proximity.
Yeah, there was one. I
Googled health grades.
I Googled myself the other day. And
Google
I
yourself.
had one review on Google that said this guy's a pervert. From 7 years ago. I have no idea who it is. I'm trying to figure out.
Yeah, no. One review. Well, no. Well, I can just say from my experience, man, Dr. Edwards always get my. Dr. Edwards got my vote. Never let me down. Very responsive too. Responsiveness and professional.
I appreciate
That's what
that.
stands out for me. So, and the care, and just the same way he's talking right now, his voice level, the same way he treats his patients, the same way he treats people. He knows how to treat people very well. So, I'm glad to have you. When I reached out to you months ago about joining the show, you didn't hesitate. So that always sticks with me, man.
So I know it's coming from a good place.
Thank you very
Good
much.
place.
Thank you. But as Comfort Measures Consulting, the Let's Get Comfy podcast, another episode in the books with the legendary Dr. Thomas Edwards. Thank you, sir. Y'all stay tuned. Be sure to like, comment, and subscribe on YouTube. Please follow along on YouTube. Subscribe to the Let's Get Comfy podcast. Look at the other episodes. Check out all our short clips. Like, comment, and subscribe on those as well. Need your support. Comfy listeners, Listen Comfy podcast. Salute.
All right.
Thank you for watching.
Thanks for